So one of the key areas this clinic is known for is our highly specialised filler dissolving and complication clinic. We have a very wide international base of referrals for people coming in with filler related problems. They're often not specific problems, but people just wanting their filler reversed. Probably the greatest concern that patients have when considering filler dissolving treatment is the possibility of developing a poor outcome, which means looking worse than they do with the filler in. That's a very reasonable concern. Our research shows that that happens in a proportion of patients, probably around 20%. And really what we do is take patients through that process. Once the filler is dissolved, we enter what we call a rebuilding phase, which can often involve surgery and a variety of non-surgical treatments. Depending on the problems the patient experiences, such as hollowing, skin laxity, or swelling, we can offer a variety of treatments, including radiofrequency microneedling, laser resurfacing, and sometimes more filler injections, but these are more highly specialised fillers in much, much smaller volumes. Surgery is a really important component of that as well, but we can often offer a good combination of non-surgical treatments to get patients the kind of results they're looking for. We use cutting-edge technology in our filler dissolving clinic. We use 3D reconstructed MRI scans to map out with great accuracy where all of the residual filler is in the face. It can tell us how much there is, the density, and the distribution. This really helps to guide our dissolving injections, but also to counsel the patients on what the likely outcomes might be. And one thing we are absolutely focused on is putting the patient at the centre of the decision-making process, giving the patient the data and information that they need to make an informed decision about filler dissolving. Many clinics use ultrasound technology to map out filler. We believe it is vastly inferior for a variety of reasons, but we can't really match the accuracy of 3D MRI scanning. It is absolutely essential as a tool in our clinic to optimise our outcomes for patients. And we see many, many patients every day with significant filler-related complications such as swelling around the eyes. Many of these patients will often have the filler dissolved and then go to surgery to fully address their concerns. One of the things we like to do during surgery is take small tissue samples when it's appropriate. Looking at these samples under the microscope has given us unique insights of how the filler affects the native tissues. And what we tend to see is that even after many, many rounds of filler dissolving, there is inevitably some filler that still remains in the tissue. And we also see that the surrounding tissue is abnormal with significant areas of inflammation and scarring. And here we have one of those slides which demonstrates what we typically see. These blue areas which are pointed out are little lakes of residual filler that are stained, demonstrating that these are really, really difficult to resolve. Surrounding them is collagenous scar tissue as well, which encapsulate these small areas of filler, which makes them almost impossible to eliminate. We can also see inflammatory cells, again pointed to here, demonstrating that the body is mounting an inflammatory reaction to these filler injections. And these types of unique insights really have helped us to hone and develop our surgical techniques to deal with these very complex type of problems and to really, really get great outcomes for patients who've had filler complications, who've had swelling for years and are coming in to have the filler reversed and to have their eyelids modified and improved.